Russia now is badly affected. France is badly affected. You look at what each country, and you can say affected or you can say infected. Either way you want to put it. But you look at these countries, look at Italy, and you look at Spain, and you look at all of these great countries in many cases, how they've had to fight through this. It's a terrible thing that happened. It could have been stopped at the source. It should have been stopped right at the source, but it wasn't. Thank you all very much. We appreciate
Speed, as he's nicknamed it. It's his plan to produce a vaccine. They hope by the end of the year. It comes one day after the nation's Chuck Todd with my co-host Katie Tur. President Trump just wrapped up a briefing to the press on Operation Warp Speed, as he's nicknamed it. It's his plan to produce a vaccine. They hope by the end of the year. It comes one day after the nation's top vaccine expert, Dr. Rick Bright, testified before the House. And yesterday, Dr. Bright warned that he believes the timeline for a vaccine will be much longer than the 12 to 18-month prediction being touted now. But President Trump struck a much more optimistic tone today, telling the American people he'd like to see a vaccine ready to distribute by the end of this year.
Another essential pillar of our strategy to keep America open is the development of effective treatments and vaccines as quickly as possible. I want to see if we can do that very quickly. We're looking to, when I say quickly, we're looking to get it by the end of the year if we can. Maybe before. We're doing tremendously well. Its objective is to finish developing and then to manufacture and distribute a proven coronavirus vaccine as fast as possible. Again, we'd love to see if we could do it prior to the end of the year.
And joining us now from the White House is NBC News' Shannon Pettypiece. So Shannon, tell us a little bit, Dr. Moncef Slaoui, I hope I got that correct. What do we know? He's a former pharmaceutical exec. Why him? And what is the hope that he brings to this operation?
Well, he has a tremendous amount of experience bringing vaccines to market. One of those is the cervical cancer vaccine that came on the market within the past 10 years. And he's sort of supposed to be, I guess, maybe the vaccine czar, if I can use that word, but the head advisor for this group that the president's now announcing today. Now, of course, there's been a lot of work going on with vaccines since this virus was first identified. But the president's trying to announce, and the message he's trying to get across today is that he's hoping to bring together the military and the public health and HHS aspects of the government to do some sort of Manhattan-style project to incredibly accelerate the development of a vaccine. You heard him talking about at the end of the year as a potential. Normally it takes years, if not decades, to get a vaccine to market, but that's the goal and the benchmark he's clearly laying out today.
And this group isn't necessarily doing the vaccine research. This group, correct me if I'm wrong, Shannon, their job is to prepare to distribute a massive amount of the vaccine, right? Because the vaccine research is going on throughout. They're in multiple countries, multiple pharmaceutical labs, right? Multiple universities. I mean, this is all the different trials going on all over. I assume this is almost as much about distribution as anything else?
Right. Well, I mean, there are parts of the U.S. government that are involved in the research, the NIH, for example. But yes, it's pharmaceutical companies, it's other countries, it's independent research labs out there that are doing the real science to this. But what the U.S. government can do is help expedite the process, get some of the red tape moved out of the way, help get a quicker FDA review for starting a clinical trial or for reviewing the data. And then the military component with this. We saw the Defense Secretary Mark Esper here today, and Trump is saying that the military will be the ones who are then sent out to distribute what could be hundreds of millions of doses of vaccine across the country. So not only do we need to develop a vaccine, but then we have to distribute it widely, which is unlike anything we've ever had to do before as a country, to distribute quickly a vaccine on that level. So that's what the president is trying to bring the government together to do.
Shannon, I was struck by how confidently and optimistically not just the president was speaking, but Dr. Slaoui was speaking, and Defense Secretary Mark Esper was speaking, promising millions of doses by the end of 2020, and that just doesn't line up with what we're hearing from all of the other experts that have either been testifying on Capitol Hill or ones that we've spoken to here at NBC News and MSNBC. They've all said 12 to 18 months is absolutely the fastest you can do this. And that's if everything goes perfectly, and nothing goes perfectly. A lot of vaccines take 10 to 20 years. Is there any internal debate within the White House about what to promise and whether over-promising might be a little risky?
Well, this president has never been hesitant to overpromise things, especially throughout this entire process. He has talked about having churches filled on Easter. He's talked about deaths could be as low as 50 to 60,000. The vice president has talked about this being behind us by Memorial Day. So there's been a pattern of overpromising. But on the way things look for this vaccine development, maybe there is some behind-the-scenes data that is giving the government confidence that we as the public haven't seen. But for those on the outside of this who haven't gotten a chance to pull back the kimono and look at the data on the vaccine trials out there, they are saying yes. Typically, under the fastest circumstances, vaccine takes years to develop because you have to study it in people. You have to find those people to test it in. You have to make sure there's enough virus in the population to actually test it in them, and then you have to give it time to see if it works and to see if it's safe. So those are all steps you just can't skip over no matter how much you want to.
Shannon, I know you've got to get back and get some reporting, but you started this off by calling the doctor essentially the vaccine czar. If I asked you, who would you identify as the testing or contact tracing czar inside the West Wing or White House these days?
Well, I think testing has become Admiral Giroir has sort of taken on that, at least the public face. So the administration is trying to put him out there. But, of course, Deborah Birx has been very much involved in that, and, HHS and CMS as well. But that's been one of the struggles. Here we are in May, and we now have, I'm, dubbing this person the vaccine czar. So that's one of the questions here is who's been in charge all this time?
No, I mean, it just sort of, today's event seemed like, why didn't we have this testing and tracing version of this event, oh, by the way, about 6 weeks ago? Anyway, Shannon Pettypiece at the White House for us. Shannon, thank you. Katie, over to you.